Hello and welcome to Public Health Uncoded with Dr. Saroj Pachauri, brought to you by Center for Human Progress in partnership with the POP movement, where POP stands for Protect Our Planet. The podcast where we unravel the complexities of public health issues and bring them into the spotlight. I am your host, Drishya Pathak, and as we step into a brand new year, we are excited to continue our journey of exploration and education and empowerment. To kick off 2023, we are diving deep into a subject that touches the very core of our communities, maternal health. The well-being of our mothers during pregnancies and childbirth is not just a health matter, it's a societal concern that influences the future of generations to come. Throughout this episode, we will be shedding light on the challenges and innovations in the realm of maternal health, featuring our experts, Dr. Saroj Pachauri, and our guest expert, Dr. Aparajita Gogoi, to share more with us. Dr. Aprajita Gogoi serves as the Executive Director of Center for Catalyzing Change, a non-profit that supports women and girls access rights and address equity, and is dedicated to creating lasting systems change at the grassroots, working with adolescent girls and women by leveraging existing platforms to providing sustainable solutions. She is also the national coordinator of the White Ribbon Alliance for Safe Motherhood India. The very successful What Women Want campaign was conceived and implemented in India under her leadership, and she guided the global What Women Want campaign as the global co-chair. So let's welcome Dr. Aparajita and Dr. Pachauri.
Hello, Aprajita. So kind of you to join. Welcome to this podcast. I am so honored that you have agreed to lead this discussion, a discussion on a subject that you and I have been very passionate about for many, many, many years. And we have been fighting the battle on this issue, on the issue of improving maternal health. We're talking about the subject of maternal health, which has been a problem for many years, and now I think is getting to be somewhat better. But I'm trying to recall the many years ago when maternal mortality and morbidity was very high, especially in developing countries. We could not bring the rates down. And we knew, you and I knew, that it was a gender issue. And that's the reason the rates were not coming down. The rates were not coming down because we were not doing anything about it. It was not seen as a problem because it was a gender problem. It affected women, and so no one would do anything about it. But now we see, thankfully, that there have been some changes in recent years. Significant improvements have occurred. And these improvements have occurred because we have finally agreed and seen and acknowledged that this is a serious problem that needs to be addressed. And programs have been implemented that have with targeted interventions and enabled this to happen. Now, there have been many programs, but perhaps the most significant of those is the institutional delivery, especially for rural women, which has made a difference, especially in developing countries. Your experience in this area, your long experience in this area, working on these issues, battling the problems, would be of great importance for us today. And I want to thank you for joining us again, for generously providing your inputs, which you have always been generous with. You recently, in fact, provided us with chapters for a book on gender that Dr. Ravi Verma and I are working on. So we are trying to build the evidence to make the difference in terms of policies and programs for improving maternal health. Now, what I would like to ask you to begin with, Prajita, is to please tell me what is the situation, the maternal health situation in developing countries today? What are some of the major gains that we have made, and what are the reasons for the same? Can you please paint a picture in nuanced terms, as you always do, of what this problem is looking like today?
Thank you, Dr. Pachauri. It's an absolute honor to do this podcast with you. And you are correct. We have been trying to look at, how do we bring in health equity and gender equity for women. And, I'm going to try and cover the landscape of what is happening today. But before we get specifically to maternal health, I do want to pick up on the point that you talked about, how interrelated gender indicators in women's empowerment is with maternal health, or even women's access to family planning and choices and quality of services. In many of the countries where maternal mortality is still high, we would see that gender discrimination is all pervasive. It has many layers, it has multiple facets, and it starts from the time that a girl is born. In many cultures, girls are deprived of their rights, whether it is education or health. They're deprived of decision making. They do not really learn negotiation skills. Their self esteem is low, their self confidence is low, and they literally have no voice. So, so you girls and women are born into a society where you are made to feel like a second class citizen. And as a girl matures into adulthood, there would be societal forces of patriarchy, of misogyny, which really bears down on her. And she ends up as a human being who has less education, less nutrition, no decision making power, no agency, and no rights to make her own choices. And this is where women's health also come into play. So in a society where women are not being able to make any choices around her life, whether it's education or nutrition or when to have children, how many children to have, when to have children. So if she doesn't have the right to make any of the other choices, then it obviously also impacts her maternal health, her pregnancy, and her childbirth experience. So I think the first issue that I would like to really highlight when we talk of where is maternal health today in the world, how do we improve maternal health, is the fact that maternal health is also based completely in gender-based power dynamics. And I think, like you said, a reason why women's health have improved in the past couple of decades is because women have started taking power into their hands. We see shifts in gender norms, gender dynamics, really not where we would like it to be. But if you look at other gender indicators, education status of girls and women are improving, early marriage is going down, contraceptive prevalence rate is going up. So I think some of these other factors really matter when we talk of maternal health. And now coming to your specific question about where are we in terms of maternal health, and I'm really sorry to tell you that actually the news is not good. In the MDG era, if you remember, MDG 5 was to improve maternal health. Many countries across the world had brought down their maternal mortality rate. Some did not meet their Millennium Development Goals, but there was progress. Recently, about a month and a half back, the statistics which was released under the EPMM, the Ending Preventable Maternal Mortality and Morbidity Report, we were aghast to see that in the last 8 years, global progress in reducing maternal deaths have actually flatlined. And this is really a cause for worry. And we've been trying to kind of figure out why has progress suddenly stopped. And since this data is for the last 8 years, it is definitely not because of COVID. You cannot blame COVID, which started in 2021, for the flatlining of the decrease in maternal deaths. So in terms of number, it's still huge today. Globally, 4.5 million women and babies are dying every year. I think that there's almost 290,000 maternal deaths. And worryingly, we still have about 1.9 million stillbirths. So all in all, if we look at where we are today globally, we are not in a good place. And in my opinion, I think progress has stalled because of primarily there has been decreased investment in maternal and newborn health. So this is something around maternal health in the global arena that we really need to look at very closely and figure out that what can we do to prevent this flatlining. And if you ask me, my recommendation is that we really pump up our policy and plans, we put in more money, we look at the very crucial aspects of quality of care, we use data for action, we look at how do we investment in health workforce, what is a response and resilience mechanism, how can we get commodities and products to the last mile, and very importantly, what are we doing about accountability and equity? Because Dr. Pachauri, you know and I know that women and children who are unfortunately dying today, they are the ones who are at the last mile. These are women who are poor, these are women who are in far-flung villages, or these are women who do not have access to quality of care. So I think globally, we have to wake up and we have to look at what we can do around maternal health because it's crucial right now. So that's the global story. But if you permit me, I want to come to the India story too. Surprisingly, and this is really good news, India is not really aligned with this global flatlining. India is doing pretty well in reducing maternal deaths, in improving maternal health. And the latest statistics in India tell us that the maternal mortalities in India has come down to 97 per 100,000 live births. And we are on track to meet the Sustainable Development Goal or the target of 70 per 100,000 live births. There are good states in India who are performing well, but the traditionally non-performing states have also started doing well. And then if you permit me to kind of try and analyze why India is showing progress, which is not like the global trend, I think it's because of 3 or 4 reasons. The Indian government has really invested in improving maternal and newborn health, and primarily coverage of emergency maternal health services has been taken to the last mile as much as possible. Emergency obstetric care services are available. The government has introduced schemes which reduce out-of-pocket expenditure for women when they go for childbirth or go for pregnancy-related care. And that some of the schemes like the Janani Suraksha Yojana or the Janani Sishu Swasth Karyakram really has been a game changer. You talked about institutional delivery. If you remember, when we met in early 2002 and 2003, India had only about 40% of women giving birth in hospitals. But in 2021, it went up to 90%. And we know that when women get to hospitals, their lives and their newborns' lives would be saved. So I think a lot of credit should be given to India for defying all adverse conditions and ensuring that women are receiving antenatal care, women are receiving a proper childbirth care, and women are receiving postnatal care. And I think there's been some flagship programs in the country, like the Labor Room Improvement Initiative, the Suman Initiative, which provides free healthcare to pregnant women, to mothers up to 6 months after delivery, all sick newborns. I think some of these flagship programs have really helped India bring down its maternal mortality. Now, having said all of that, I know that we still have many more miles to go, and I think by looking at the trends in the country, we should be able to, not just meet our goals, but to ensure that there are no unnecessary deaths. Sometimes when you talk of numbers, it may sound measurable to say 100, MMR, bring it down to MMR of 100 or 70 or 80. But I think about the family for whom numbers don't matter, but what matters is the life of the woman and the baby. So I think our target right now should be to stop every single unnecessary maternal and newborn deaths. And that's what we are hoping for.
Well, this is music to my ears. What you have just said is absolutely music to my ears, and I cannot, I'm really trying to absorb it. Yes, I was aware of it to some degree, but your articulation, your eloquent articulation, and your nuanced explanation is of immense value to me. And I'm thinking, where were the days when we were crying out loud, do women's lives matter? Do women's lives even matter? And today, well, I don't know. We still have a patriarchal society, undoubtedly, but apparently there has been a significant change and a change for the better. So this is wonderful. But I would also like to ask you, we're talking about the last mile, reaching the last mile. How should we do that? What strategies should be employed? What should service providers do? What should women do? What should households do to get to that last mile, which we are now striving for?
So I think your question about last mile is the most important one. And the conversations that we are having with everyone who cares for mothers and babies and women's health and rights is the fact that we have to do business differently now. So the business as usual plus additional investment plus positive changes have brought us down to, I hate to say the phrase low hanging fruits, but I think we have done that, been there, and now we really have to do things differently. And while doing things differently, it has to be a multi-sectoral work, because I often feel that when women's health are controlled by so many other factors, it is almost unfair to just ask the health system or the health ministry to bring down maternal deaths. And I'll give you a couple of examples. If you look at the data around the world today, in the pockets where maternal deaths and newborn deaths are high, those are also areas where there is high child marriage and high teenage pregnancy. So we know there is evidence which tells us that a young mother is almost 50 times more likely to die of a maternal death than a matured woman. So I think right now, to kind of at the last mile, we have to look at what are the other factors which influence a woman's reproductive or maternal health. So, for example, prevention of child marriage is going to lead to better maternal and newborn outcomes. Now, how do we prevent child marriage? There is evidence that education of girls is extremely important. There is evidence that if a girl finishes even 12 years of education, rates of child marriage go down, uptake of contraceptives go up, and even there is a contribution to countries' gross domestic products. So I think we have to look at what are the other factors which are ruling women's lives. So social norms like child marriage has to be tackled. Education of girls have to be tackled. Women's workforce participation has to be looked at. So yes, we have to take quality services to the last mile, but we also have to look at the other factors which are influencing women's health and maternal health. So that's one thing. I think the second thing really is the quality of care. I don't really have to explain how important quality of care is. There is quality of care provision around the world, but I'll give you an example. We did a campaign called What Women Want, and we asked 1.3 million women across the world saying, what does quality of care mean for you? And maybe you won't be surprised. I was not surprised, but many people were surprised to hear women say the highest ask was respect for maternity care. So we tried looking at the data, disaggregating the data to understand why has women placed respectful care as the first ask and not 24/7 operation facilities, specialists and doctors. And women told us repeatedly that we do not like to go to a facility where we know that we may be physically abused, verbally abused, discriminated against because I'm an adolescent mother or I belong to a very poor family or I'm less educated. So I think when I say that we have to do things differently, so what I want to give you as an example is when we talk of quality of care, we have to look at respectful care. And that is going to get us better dividends. The third solution that I want to put forward in order to reach the last mile is we also have to invest in a health workforce. And I think COVID clearly made it evident to everyone the kind of pressure, the kind of work, the kind of pressure our health workers are under and the kind of contributions and work they can provide. So I think a big ask right now is to invest in building a very, very robust health workforce. Again, I want to give an example in India. In 2019, India introduced a new cadre of health workers called the nurse practitioners in midwifery. And Dr. Pachauri, you may know that for 20 years, India has been asking for a professional cadre of midwives, not traditional birth attendants. And today, there are, I think, about 14 or 15 national training institutes which are training these freshly minted midwives and who would then go out and set up midwifery-led care units, which will not only provide women-centered care, but also really provide respectful care. So I think there are things that we can do, whether it's around social norms or around what changes that we can bring around in the health workforce. And I think the last thing, because you also asked me about what families can do, I think it's really, really important to work with families and communities to kind of really, really work with them to say that, girls in your family must have equal value. You cannot really treat your daughters like second-class citizens. She has her right to education, her right to healthcare. She has the right to choose when to marry, when to have children. So I think a lot of work also needs to be done around some of the societal norms and parameters. And of course, then, families also need to know how to prepare for birth and how to ready for complications. The 10 to 15% of all births can become complicated obstetric emergencies, and families must know that which are the facilities nearby which can save the life of the mother and the newborn. So I think those are some of the actions if multiple countries across the globe can take up, we will see the difference.
Well, you spoke repeatedly about respectful maternity care. And that is something that you are right. Not many people even think about. But we know, and you've done research on this subject, that it is a problem, and it's a serious problem, and a seriously perceived problem by women, which prevents them from even entering the health facilities because they're afraid of being abused, of being insulted, of being mistreated, and so on. But that again, you see, is an issue of gender, really, because patriarchy, where it's prevalent, cuts across the society, where women's work is not valued, where women are not valued, family, where they are again, treated not as well as the boys are, for example. And the health system is, after all, a part of society, and therefore is also subjected to the same societal factors, the same societal pressures, and doctors and paramedical workers and self-care, providers of healthcare are also part of that larger society. So when one looks at it in that sense, one should not really be surprised that they behave in the same way towards women, who are treated differently by them as they are by society in general. Now, this area is, in a sense, not seen as technically seen as part of the quality of care, which you spoke of as the larger realm in which we need to make improvements if we are to go the last mile. So, when we talk of quality of care, we are not just talking about the technical quality of care, or the provision of drugs, or the provision of cesarean sections, or the availability of blood transfusions, and technical things that would improve life, prevent death, and so on. We are also talking about the social components of the quality of care, which are related to issues such as respectful maternity care. So, and this permeates certainly in patriarchal societies and probably the world over, because there are discriminations the world over, on the health of women, particularly of women and newborns, which is very much interrelated. And so that, I think, is an extremely important factor. But what I want to ask you as a last question is that now that we do have programs, they may not be of the quality that we desire, and that needs to be improved, no doubt. But what are the program priorities that should be emphasized for the future? How should we proceed in the future? What is the way forward for improving maternal health?
So, you talked about how respectful maternity care is very tied to gender norms. But I also want to talk about gender norms and health workforce. The general health workforce is 70% women, but you see gender differences by occupation even within the health workforce. Whenever we talk to midwives and nurses, they talk about gender disparity in pay rates. They talk about having almost negligible career pathways, and they talk about having no decision-making powers. They talk about not having access to decent work that is free of stigma, violence, or discrimination. So when we are talking of this interface of gender dynamics, we also must talk about how gender dynamics not only influence the women who are coming for services, but also impacts the women who provide services, right? And I think it's really important to talk about this, because gender inequities in the health system itself needs to be really disrupted. We need enabling and transformative policies which really guarantee a more enabling environment that also looks at how women in the health workforce are being treated today. But I'm going to try and answer your question about what needs to be done. It's almost like a summary of Dr. Pachauri, what we have been talking about. I think one thing that needs to be done is that we have to really make it evident about the close connection of agency empowerment and health, access to health services of women. So we have to really amplify the volume when we're talking about that girls need to be educated, girls need to have access to proper nutrition, girls should not be married off early, women should not be subjected to early and multiple pregnancies, so that maternal health can improve, and women themselves can really be better human beings, self-sufficient human beings, women who can join the workforce. So I think my first recommendation is that we cannot work anymore in silos to reach our health goals. Our health equity is achievable only if there is overall gender equity, and that's the reason we have to look at some of the causal factors which are leading to less than optimal women's health. So this is, I think, my first recommendation. The second recommendation is, of course, I gave the example of India, my country, where we have done well, but there are many, many countries who are still struggling to bring down maternal and newborn deaths. So there could be exchange of ideas, exchange of good practices, which can be replicated in other countries which are in similar resource settings. I gave the example of India's conditional cash transfer scheme to women to bring women to hospitals. I gave the example of India's labor room improvement program called Lakshya, which looks at really improving the situation in the labor room. I talked of India's Suman program, which is a kind of a safe motherhood assurance program, which has a charter of rights which women have, which women must be provided for. So I think there is a lot of scope for transferring some of the good practice from one country to another country. That's my second recommendation. My third recommendation is really to invest in the health workforce, because they are the ones who are standing at the last mile delivering services. And I think the fourth recommendation is really, really to focus on quality of care. The improvement in quality of care would be slightly different in different geographic settings. In certain places, we can talk about bringing in, really, really amplifying ideas like midwife-led care units. In certain geographies, we have to talk about getting services closer to women's homes, women's houses, so that they can access service more importantly. So I think those are some of my recommendations, but I think that we really need a 360-degree approach that builds on the successes so far and really looks at ideas and interventions which can be leveraged for better maternal health outcomes for women and the babies.
Well, this is a comprehensive agenda, and it's an intersectoral approach that you're referring to. It requires the inputs of a large number of ministries in a large number of sectors, and it talks about a variety of different interventions that somehow have to be brought together in an integrated way so that we can target the problem that we are trying to target rather than in silos. I think this is probably a generic approach that you are referring to, and not surprising. It's the case with almost all problems that we are dealing with, social problems, health problems. We tend to move in silos, at least initially, and then we realize that this is by itself not going to finally achieve the objectives and the goals that we are trying to achieve. So I think this is a very important point, and I really, really appreciate the picture that you have painted. You painted a beautiful picture which clearly shows us what has been achieved, how far have we come, and how far have we to go. And in order to go the last mile, what are the interventions that we must undertake? And you have, in fact, also said something that we know about many other problems, is that there are best practices somewhere in this world which we can emulate. In this case, it happens to be the case that India is providing some of the best practices, of which I am very proud of. And if those practices can be adapted, can be implemented to local situations in other geographies, it would make a big difference. So we do need to work together. And we need to work together not only within countries, which is big enough a problem in a country as large as India, but with other countries that are struggling to make a difference in terms of maternal health. Thank you so much for this discussion, leading this discussion. I am truly grateful to you for doing so. Thank you.
Dr. Pachauri, thank you so much for inviting me to be part of the podcast. And I have to say something in closing, which I believe very, very strongly in. I think we have to create forums where we try and hear women. We have to ensure that women are speaking up. We have to amplify what they're asking for, and we have to commit to what women are asking for. Because every time we go to a village, we talk to women, they are the ones who are living the problem. And they are the ones who really know what solutions work in their context. With all the good intentions in our hearts, we design programs for them. We support policies which are being made for them. But very, very rarely do we really ask women, what is it that you want? And our experience of the What Women Want campaign really told us that it's so important to get the voices of women up there. And for example, that quality of care, what matters most to women is respect for maternity care. This information came because we were willing to listen to women. So going forward, I think we have to work hard, be creative to ensure that we are including women in the conversation. So that's my kind of last message for you and for the listeners. And thank you so much for including me in this. It's been a pleasure. And it's really, really nice connecting with you after such a long time.
Thank you. In fact, I'm so happy that you have reiterated this point. Women's voices must be heard, women's voices must be amplified. Programs should be implemented not for them, but with them. And that will make the difference. Thank you.
The way Dr. Gogoi presented, there is so much that revolves around maternal health. Reflecting on the historical neglect of maternal health, especially in the context of gender dynamics, there is an unfortunate reality to maternal health that it was not considered a priority for a significant period, largely due to its association with women. The prevailing mindset, deeply rooted in gender discrimination, hindered the progress in addressing this crucial aspect of healthcare. Despite some progress that was made during the Millennium Development Goals era, the recent statistics point out that the progress achieved in the past 8 years has plateaued, revealing stagnation in global efforts to reduce maternal mortality, which is a concern. The discussion very intricately mentioned the challenges such as health workforce development, data utilization, and the need for accountability and equity, and the ways to address these issues, like with renewed attention, increased policy measures, financial investment to combat the stagnation in reducing maternal mortality rates. Although some developing countries, including India, due to their proactive measures, have made significant progress, but what is needed is constant and continued efforts and exploration of innovative strategies. This is important, and to address societal norms, empower women, ensure respectful maternity care, to achieve lasting improvements in maternal health is what we need to focus on. To sum up, better maternal health is a shared responsibility that extends from policymakers to healthcare providers, communities, and households. We can collectively strive to make a lasting impact. On that note, thank you for being a part of our community, and we look forward to another year of learning and growing together with Public Health Uncoded with Dr. Saroj Pachauri. We'll be together in 2024.